So, your kid's trans. Now what? There's probably a lot going through your mind. It's probably really confusing, and it's probably really scary. I get you. I really do. It's really scary and confusing to realize you're trans, honestly. Your kid sent you this video because they love you, and because they trust you with this knowledge. Your kid wants you to know this important part of their identity, and that's really great. You must have fostered a very trusting relationship with them to get to this point. So, what now? Well, your child may have asked you to refer to them with a new name instead of pronouns and start socially transitioning. If this is the case, please do your best to actually do so. This is deeply important to them. It can be really tricky to change what name and pronouns you're used to, so why don't you try using them in a sentence right now? If your kid is trans masculine, you could say, "I love my kid so much. He's a good son to me, and I really appreciate him and what he does." If your kid's trans feminine, you could say, "I love my kid so much. She's a good daughter, and I really appreciate her and everything she does." If your kid's neutral or non-binary, you could say, "I love my child. They're such a good child, and I really appreciate everything they do." Of course, substitute my child with their name. Their chosen name. Please keep in mind that refusing to use they for your child because you think it's plural is not only rooted in transphobia as an excuse to not gender your child correctly, but is also blatantly incorrect. The use of they as singular is already used often and has been since the 14th century. You've used singular they many times when referring to somebody you don't know the gender of. For example, "Hey, that's the new person's locker, right? I wonder when they're going to be here." The Oxford Dictionary has recorded singular they being used all the way back to 1375, so it's pretty old. Using the correct name and pronouns is very important. When you misgender your child on purpose, you're telling them that you don't respect their very identity, and that's a really shitty thing to do. Of course, not all misgendering is purposeful. I'm going to go with the idea that you're not going to do it on purpose, which is good. Purposely misgendering your child would fall into the category of emotional abuse and neglect, and you don't want to be abusive, right? Of course not. So you accidentally misgender your kid. This can, and likely will, be quite upsetting for them. The best you can do is apologize, correct yourself, and move on. If you linger on the topic and profusely apologize, it's just going to put unnecessary burden on your child to reaffirm that it's okay for you to misgender them, when in reality, it's not. It also makes the situation about you, who keeps apologizing, so just give them a gentle apology of, "Oops, sorry," and correct yourself, then continue the conversation. The absolute worst thing you can do is brush it off, saying something like, she, it, whatever, is the worst possible outcome, and is transphobic. Brushing off your child's pronouns or calling them an it in a derogatory way they didn't ask for is rooted in transphobia and the idea that trans people are subhuman. So please try your best to respect your child's pronouns and correct yourself and those around you when they are misgendered. Correcting yourself and the people around you when your child is misgendered will show them that you love them and care about them and their identity. There is, of course, also the problem of dead naming. A dead name is the name that you gave your child when they were born, or another name they used to go by. I'm sure your child very much appreciates the name you gave them, but it may not suit their current gender identity. Please understand that your child is not trying to hurt or disrespect you by changing their name, and they just want to have their identity respected. The reason it's called a dead name is because the name is dead to us. The name no longer represents us. It represents someone we were forced to be, and that we're not. When you call your trans child by their dead name, you're reminding them of that former identity and the closet that they were forced into most of their lives. There's probably also a lot of new words that you're going to be learning through this journey with your child, so here's a little rundown. Trans or transgender. This refers to basically anybody who identifies out of their assigned gender. This is a large spectrum of people that includes a lot of various gender identities. Cisgender or cis. This refers to somebody who is not trans. Some cis people feel like this is a slur, and that's simply not true. This is a term often used in the medical field as well, and is simply an indicator of what you are. Transgender is the exact same way. When your trans child refers to you as cis or cisgender, they're simply using that as a way to explain that you identify as the gender you were assigned at birth. This may be brought up because they're talking about an experience specific to trans people, and therefore you wouldn't understand due to the fact that you are cisgender. Trans masculine, trans male, trans man, trans boy, etc. This refers to anybody who was assigned female at birth but now identifies as a man. He may want to cut his hair or bind his chest with a chest binder and buy boxers. He may also want to eventually go on the hormone testosterone and even get surgery to remove his breasts. Transition is different for everybody though, and he may not want any of those things. Hormones and surgery are very permanent and don't always give the desired results. Your child will tell you which of these things he wants when he's ready to, and more about these will be talked about later in the video. Trans feminine, trans female, trans woman, trans girl, etc. This refers to somebody who was assigned male at birth but now identifies as a woman. She may want to grow her hair out or buy breast forms and bras. She may also want to eventually go on the hormone called estrogen and get surgery that gives her a more prominent chest, laser hair removal, or surgery to reconstruct her face to be more feminine. As said before though, transition is different for everybody, and she may not want any of those things. She'll tell you when and if she's ready for these things that she would like. Non-binary or NB. This refers to somebody who, regardless of what they're assigned at birth, identifies as neither fully man or fully woman. This can mean they are agender, which means having no gender or being genderless, gender fluid, where their gender shifts between man, woman, and many in between, depending on the day or their mood. Their gender shift may last a few hours, days, or months. Just remember, when their gender is different from the one it was before, you should make an effort to respect their current name and pronouns that they're using. Also, a good thing to remember is that you can ask how they feel that day. It not only helps you know what gender and name to use, but makes them feel valid and that you care. Bigender, where he identifies two genders, often man and woman, but sometimes others. Demigirl or demiboy, where they identify as partially a boy or a girl, and partially something else. That something else may not be specified. Or genderqueer, where they feel like their gender is inherently queer or complicated. It can be a whole plethora of options. There's a lot of genders out there, and you may not understand your child's identity, and that's okay. You really don't need to be honest. You don't need to understand your child's identity in its entirety. A lot of people's identities can be very personal and very complicated. What matters is that you love and respect them. There's also the next discussion. Gender presentation. Gender identity and gender presentation are very different. How one personally identifies and how they present themselves can be completely different. You've probably already seen people with different gender presentations than their personal identity. If you've ever seen a feminine gay man or a butch lesbian, that's gender presentation. A feminine gay man presents femininely but identifies as a man. Trans men can be feminine while still being men, and trans women can be masculine while still being women, just like cis men and cis women can. Some people may also want to present androgynously or flip between masculine and feminine. This is totally fine and normal. Clothing doesn't have to align with your gender identity, and clothing is gender neutral anyways. It's perfectly fine to wear skirts and dresses and be trans man, or prefer pants over skirts while being a trans woman. Wear whatever makes you comfortable. You're still valid. Even cis people like to play around with gender presentation, and it's healthy to explore what clothes and presentation makes you happiest. Now, let's move on to the scary part. Let's move on to medical transition. This is those scary hormones and surgeries I mentioned earlier, and I'm sure it's really scary to think your child would permanently change their body and may even feel like your child hates their body, and something that you had part in creating. This isn't the case though. Surgery and hormones are an act of self-love. Your child loves their body and they want it to be what they can make of it. They want their body to be something they can love. And I promise you that if you allow them to get these things, the happiness in themselves and their body will increase immensely. Let your child love themselves and their trans bodies. If your child is trans, they may want testosterone or estrogen. This is commonly done via an injection, but it can also be cream, pill, or other method. They may need to go for bi-weekly blood work to check their hormone levels, for the first while of them being on it. Please work with and trust your doctor when they talk about hormone therapy. It does have some risks, but more often than not, the rewards far outweigh them. Especially when, if your child really wants it, not getting it could result in depression and even suicide. When going on hormones, your child will start to get physical changes. They're different for everybody and may happen very quickly or very slow. Your child may have behavioral changes, body hair changes, weight redistribution, and other more intimate changes that you need not know about. If taking testosterone, your child's periods may eventually stop, and if taking estrogen, your child may begin to grow breasts. Some trans people may also choose to stop taking hormones after taking them for a while because they want to keep the permanent changes but want to get rid of some of the temporary ones. This is a normal experience, and hormone therapy is very personal to each trans person who wants it, and may look different than what you expect. Your child may also eventually want surgery. If they're transmasculine, they may want top surgery, which removes all of the breast tissue and resculpts it to look more masculine, where there are a variety of options for that, ranging from keyhole to double incision. Please talk with your doctor and your child and your surgeon to figure out what form of surgery would be best for your transmasculine child. If your child is transfeminine, they may want surgery to make their face or body look more femininely sculpted, or want laser hair removal, which we count as a type of surgery usually, even if it doesn't really fit in that category. If your child is non-binary, they may want a mix and match of surgeries, or none at all. This is all valid, and as I said before, some trans people may not want to medically transition in any way, shape, or form. These are big decisions and make permanent changes to their body. Some trans people want these changes, and some don't. Your trans child's identity is valid and true regardless of their desire or lack thereof to medically transition. So, there's some of the basics about being trans. There's a lot more I could get into, like neopronouns, xenogenders, and how neurodivergency affects the gender experience, but I think that's for another video. I hope you gain some basic info from this and have a better understanding of your child and their wants and desires, and to make them feel more comfortable in their new identity. It's important to remember at the end of the day, their identity is their own. And it's also important to take note that coming out as trans is a very personal experience, and while they may be ready to tell you and trust you, they may not want other people to know. Please do not out your child to anybody without their consent, and make sure to discuss with them who they're ready to come out to and when and how you're going to do it. So, your kid's trans. Now what? You love them. Plain and simple. Love them unconditionally, as you should, regardless of what they identify as. I hope you enjoyed this video. If you like what I do, maybe consider subscribing. It's cheap and easy. I'd also like to give a shout out to my patrons who help make videos like this possible. If you'd like to be featured in my video like this, consider becoming a patron for as little as $1 a month. Link in the description. Thanks for watching, and I'll see you all in the next one. Bye.